Ramp lesions can broadly be classified into three groups. One with a stable tear, which can be treated conservatively. The second group includes lesions where the tear is present in the meniscus, and the meniscocapsular junction remains intact. The third group includes lesions where meniscocapsular lesion is torn. In Group 3 lesions, because of the tear of the meniscocapsular junction, the capsule falls back, and the meniscus and the capsule come to lie at different levels. In this case, we can see that the capsule lies below the meniscus and has to be lifted to bring it to its position. To repair this type of lesion, we require the following set of instruments. The scope is passed in the posteromedial corner and a posteromedial portal is made using a spinal needle guidance. A cannula is passed through the posterior medial portal. Once the cannula is in place, bites in the torn tissues can be made using a mini suture passer or a suture lasso. In the model shown, the blue sheet represents the capsule and the white structure represents the meniscus. The wires are passed through the meniscus and then the capsule and knots are placed using a knot pusher. Depending upon the length of the tear, multiple knots can be placed using the principle of one knot at every 5 mm. The same process can be performed using a suture lasso. The choice between mini and a lasso depends on surgeon's preference and pattern of tear. The steps shown can also be performed by making two posteromedial portals. A particular style of suturing, called the shoelace technique, has also been described in literature. The technique starts like the one shown before, but in this technique the capsular suture is stitched back to the meniscus and the meniscus suture is stitched back to the capsule. The process is repeated till the meniscocapsular gap closes. In group of ramp lesions where the meniscocapsular attachment remains intact and the tear is present only in the peripheral part of meniscus, the technique of all-inside repair can be used. The technique of all-inside repair is being shown on the meniscus model.